take the time.
Okay, Judge, we ready? Yes, sir. Okay, good. Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager. And let me announce what we're going to do in this press briefing. This is our daily city-county joint press briefing on COVID-19 to help keep our community informed of our statistics, but as well as some of our operational procedures we're doing at the local, county, and today even at the federal level. We have Representative Cloud, who's going to speak today. As I just mentioned, United States Representative Michael Cloud from the 27th Congressional District is going to begin our conversation this afternoon. Nueces County Judge Barbara Canales will introduce him. Following him, Judge Canales will continue to talk about operational procedures from a county level. Her, on behalf of the county, initiated some additional orders today, or extended some of the orders, and she'll clarify that. Following her, Mayor McComb will talk about Palm Sunday, which is this Sunday, and we have been in touch with the Archdiocese today and have update from them in terms of the actual Palm ceremony that takes place and some of the changes, unfortunately, that will take place this year. I will continue our briefing by giving you an update on our statistics in terms of COVID cases, give you an update on our public safety members who were quarantined, and talk to you about our stay-at-home directive that I issued today for our city employees. We're updating that given the federal, national, and local directives. And then Annette Rodriguez, our public health director, will talk about drive-through testing that's going to take place tomorrow. We will have probably another 20 or so persons that will go through that drive-through testing site tomorrow. So with that, let me have Nueces County Judge Barbara Canales come up for a few minutes to introduce Representative Cloud.
Thank you so much. Yes, it is my distinct honor and pleasure to welcome to this press briefing Congressman Michael Cloud. And obviously, you know, he represents our jurisdiction and so many other counties, but what I think I really would like to be able to say is that literally since throughout this entire process, not only has he come many times to our office to inquire about Nueces County, our resources, our people, our needs, but just on a personal level, every once in a while, for no reason at all, I'll get the most kind and generous text from him just checking on me as a leader. And I just want you to know that those are the types of moments, particularly in times of crisis, where you truly recognize what leadership and character is about. And so when we asked about maybe a week and a half ago for him to get involved with our needs with regards to supplies for our drive-through testing, it was an instantaneous text. Tell me and describe for me what it is that Nueces requires. And by the time that we had finished that dialogue, we were already well on our way to at least having an advocate. No one can make supplies appear instantaneously. But to have someone who will fight for you is something that's very treasured by our office and by this community. And so he's here today to explain what's transpired at the federal level, which also triggered both government orders and our orders today, which I'll share with you in a little bit more about. And I think we can all rest easy to know that when Nueces calls, he will answer. Please welcome Congressman Cloud, who will share more details about the federal initiatives, the CARE Act.
Thank you, Judge. I appreciate it, and your kind words mean a whole lot. And anything that's done at this significant level requires work at the federal level, state level, the local level. You're the voice and the boots on the ground, and we have to have your voice in the mix. And it's awesome being part of the team that's getting the job done here locally. you know, this is a situation, of course, a challenging situation for all of us individually, as leaders, something that was certainly not foreseeable in the magnitude and the scope of what we're having to deal with. And it's great to have great people to work alongside with, and so thank you for that. Of course, our first concern in all of this is the human toll that this is taking, and what it takes to recover and to deal with those who are in danger, those who are dealing with the COVID-19 situation. Some great work's been done here in regards to getting a testing site set up and doing what we can to make sure that we mitigate as best as possible the spread here locally. And so a lot of credit is due to Judge, to Dr. Blow, to the mayor, to city manager, to everybody involved here locally, our state officials as well. Wanted to give an update as well because I know a lot of people are also concerned. We've had almost 10 million people file unemployment recently, and so the economic side of things is a concern as well. That's future cures. That's you know, people being able to provide for their families, and even all the health issues involved with that. So less than a week ago, I was in D.C. To vote for the CARES Act. It's $2 trillion. I never imagined I'd be voting for a $2 trillion bill, but to put it in perspective, our GDP, about 1 month of our GDP roughly is about $2 trillion. So if you can imagine trying to bridge the gap of what it means to shut down an economy for an entire month, it is quite significant. Many of you, of course, have heard about the rebate checks that will be coming to every American. That's about $1,200 for single, $2,400 for married, $500 per child. It starts phasing out at about $75,000 in personal income. A lot of people have asked, do I need to apply for that? The answer is no. You should receive that automatically over the next 2 to 3 weeks. Of course, in a country as many people as ours, there's going to be certain instances where someone doesn't get their check, and if that happens, feel free to contact our office. We'll be willing to help and work with you. Wanted to let you know also about the new Paycheck Protection Loan Program. This is for small businesses. Small businesses have been extremely hurt in this situation where so many of them working to meet payroll month by month have had to close their businesses, and the idea of this is to keep the relationships between small business owners, their employees, small businesses, and the lending relationships they have. And so the way that this program was designed was to help small businesses be able to keep their employees on payroll as we go through this. And so I bring it up today because the small business just last night posted the guidelines for it and is expected to have this program stood up by tomorrow. And so by tomorrow, you should be able to go to your lending institution and begin to apply for these loans. And you want to get information on it, you can go to the SBA website. We set up a website as well. It's tx.us, or TX27 updates, I apologize, TX27updates.us, to kind of triage the information flow that's coming from the federal perspective for our district. And so you can go there as well to get information on that. Of course, included in that bill was all many of the needs. Our hospitals have been on the front lines of this, our healthcare workers, and they've just been working out of the goodness of their heart, many of them not knowing how we were going to continue to operate, all the expenses that it takes to operate. And so there's $100 billion in this plan for hospitals, healthcare providers, $150 billion for state and local governments, and we'll be doing our part to make sure that our case is made for that. FEMA, $45 billion for FEMA, and then some help with unemployment support, help for our farmers, money for our veterans health care, nutrition programs like SNAP, Meals on Wheels, and such. And so wanted to make sure that you're aware of the help that is coming at the federal level, and specifically for small businesses with that program being stood up tomorrow, wanted to make sure that you're at the front of the line when it comes to that. And so also wanted to make you aware of a new grant that has come out. The CARES Act passed last week. HUD received $12.4 billion to be allocated and dispersed as quickly as possible. So far, $3 billion has been dispersed, and of that, Corpus Christi will be receiving today, I believe, $1.6 million in a CDBG grant and just over $800,000 in a economic shelter or emergency shelter grant. And so that's some good news in what is, of course, a very difficult situation. But the thing is, of course, there's many challenges ahead, but there is light at the end of the tunnel. And it's awesome to see how our community members are coming together to fight this as Americans, as community members, as friends and neighbors, as family members. I say coming together, of course, at proper social distancing guidelines, right? But coming together in heart and mind and spirit to fight this. I know that we will get through this as a community, we will get through this as a nation, and see brighter days ahead. So with that, God bless you. Thank you for giving me a moment to be with you. Appreciate the opportunity to work with you today and through this circumstance. Thank you.
En resumen, esta es una situación difícil y con muchos retos. La mayor preocupación que tenemos son las personas. Se ha realizado muy buen trabajo a nivel local y a nivel de condado. También les quería dar información actualizada de ya son casi 10 millones las personas que han aplicado para desempleo. Es difícil de tener una economía por un mes, pero también se ha escuchado de los cheques de beneficio que se les va a entregar, esperan entregar esos cheques de 2 a 3 semanas. También tenemos el programa para pequeños negocios, Paycheck Protection Program, o programa de protección para su cheque. Los pequeños negocios van a poder ir a su institución bancaria el día de mañana y poder aplicar por esos préstamos. Asimismo, queremos anunciar un fondo especial por parte del Desarrollo Urbano y de Vivienda, donde la ciudad de Corpus Christi va a recibir un fondo de $1.6 millones.
Thank you. From the county's update today, we had a press conference earlier, so I don't want to really repeat everything that we talked about, but I'd like to give you the highlights. Earlier today, around the 3 o'clock hour, I issued amended orders. These orders amended the orders I originally signed on March 25th that were to extend till April 8th. To conform with the governor's orders, we extended those orders till April 30th. Now we're aligned with the state of Texas. I think this is a very good thing so that we can all be on the same timetable. In addition, there was 2 substantive changes to the order, both of which, one I just mentioned, which was the time. These are effective immediately. We won't be waiting till midnight. They'll go into effect immediately, as I've already signed. They're posted on our website. And as always, we have that informational hotline. You may even get me again tomorrow morning. Tomorrow I'm on duty. So from 8 a.m. to 5 p.m., we have the phone number 414-6000. You can call, and we're there to answer your questions. However, the orders are the same, except for this one is going to last until April 30th. And here's the other major substantive change, and that is just like the governor's order, we have deemed churches and religious institution worship services essential, and that is an exemption to the rule. And so I think it's very important that you take a look at the order. As always, the spirit of the order is to keep people safe. And so when you can work remotely in the religious avenue, that's what the governor has asked us to do, where we can do audio or video or any kind of remote services. This is what we are asked to do. However, if that is not available for your particular church service or worship service, there are guidelines that can be employed that are the same ones we've been saying, which have to do with social distancing and making sure that we use all the sanitary and hygienic means to make sure we can keep our contacts to a minimum and keep people safe. I should mention another substantive change that is very important because it's different. And that is that there are no more social gatherings allowed. You'll recall that we talked about earlier where we could gather in groups of 10 or less and employ our social distancing techniques. But no longer is that going to be the case. And of course, I want to explain why. This is so that we can reduce the spread of the virus. Texas has made their orders very clear that we all have a responsibility. We can all do our part to do the right thing, and these groups are not going to help. So unfortunately, that great pickup game of basketball It's just going to be on hold. That's all for just a while, and it'll return. And so I think that's very important that we understand that the social gatherings, we can no longer gather even in groups of 10 or less, except if they're your family or your household. So the McComb family can still gather, the Canales family can still gather, and your family can still gather. We want that. Remember, these orders are meant for you to be able to move in the jurisdiction to do whatever you need to do that's essential, just not necessarily to do what you want to do all the time, but what you need to do. And again, I would ask that we use our common sense and best practices. When you go to your store, if you can, that's a need. You need to go to the grocery store. You need to go get something for your home. Please use the best practices. Try to limit your shoppers to 1 or 2 per household. It's not a family outing. So make certain that you can use these techniques so that we can keep our community safe. Our orders are on our website. And as always, I want to give thanks to everybody who is helping me explain the orders from the city staff and the county staff. And I will say that I believe by working together, after visiting with so many citizens, businesses, and members of our interfaith community, that I am more confident than ever that we can reduce the spread here in Nueces County by employing these methods. And again, the order is a piece of paper, but it is the law. And it is very important that you understand that while we are here to educate and to promote public health and safety, we must be firm. And we must be firm so that we can save lives. Thank you again, and please don't forget 414-6000 is the number for the hotline. Thank you.
En resumen, acabo de actualizar mis órdenes que reflejan las órdenes a nivel estatal. Las órdenes están disponibles en el portal de internet o puede llamar al 414-6000. Las instituciones religiosas están exentas de las órdenes. Lo más importante es mantener a la comunidad segura. Si una iglesia puede ofrecer servicios en línea, es muy recomendable que lo hagan y para evitar así el tener grupos sociales. Le pedimos que siga practicando el distanciamiento social. Otro cambio es que no están permitidas las reuniones sociales. Antes era solamente para 10 personas, ahora no están permitidas las reuniones sociales. Le pedimos a la gente que continúe con el distanciamiento social o que si tiene alguna pregunta que hable al 414-6000.
Okay, thank you. This situation is really bringing a lot of people from different walks of life together, and I think it's wonderful that we're all working together in this. And you have to keep your sense of humor in situations like this also. But you'd be pleased to know, and I want to thank Texas A&M University College Station. They have provided 50 testing kits, and these kits were coming from the A&M Veterinary Medical Diagnostic Laboratory. They use these kits. The coronavirus has been around for a long time in animals. And so the simple test that they use, or the methodology, I suppose, A&M Veterinary Medicine is providing us 50 new test kits to the health department. We appreciate that very much. They're normally used for pigs, cows, and chickens. But folks, we're all in this together. And if it works, it works. And at this time, we're thinking outside the box, and we're going out to the pasture and into the chicken coops. But we're going to beat this thing one way or the other. And so you do have to keep your sense of humor, and I think it's wonderful on behalf of A&M, and we want to thank them very much. And we want to thank all of the others that are on the front line on a daily basis that we sometimes overlook or forget, not intentionally, we just get busy. But the doctors, the nurses, the technicians, the testers, the people in the courthouse and in the city hall that are keeping the governmental operations functioning, they all deserve our great appreciation, and we don't want to overlook them. And we can't say thank you enough. So every chance I get, I'm going to say thank you to those folks because it really makes a lot of difference. And to show you again what bringing together in tough times, you've got a Baptist up here going to be telling you a little bit about what the bishop has done. For Palm Sunday this weekend, the Bishop Mulvey has discontinued or is going to continue to not have the Mass, the public celebrations of Mass, and they've been suspended until further notice. but the bishop says that's no excuse. You still can worship, and that first you need to pray, and that, Bishop, I think we're going to expand that not just for the Catholics, but for everyone, Baptists and Methodists and Episcopalians and whoever. All of us need to be praying, and we want to encourage you that, particularly as we're entering into this Easter season. Read scriptures, have meditations and discussions at your home. Learn some more and tell some Bible stories and learn a little bit about that. You can watch them on television. You can watch them on the internet, on Facebook, whatever. But use this time to worship and celebrate with your family. Be creative. And then we want to remind you to stay home, don't roam. We talk about the Facebook. Someone sent us, I saw someone had something up on there that I think was a great message. It says, we're not stuck at home. We're blessed to have a home. And I think as this Easter season here, we really need to count our blessings. There's a lot to be thankful for, and we've got a lot to be thankful for. So we're running into some tough patches, but if we do that, we'll remember and keep things in perspective. And on my way down to this press conference, I noticed TxDOT has even gotten into it on their flashing signs. They talk about COVID-19 and a number to call. Then they also flash up a sign that says, no close encounters of any kind. And what that means is you keep your distance both on the highway and in your gatherings, whether at business or wherever it is, you try to maintain the distance. So I think we're making substantial progress. And just one thing that they didn't ask me to say, but I want to say it, is that there's some confusion. We've heard about the 14-day time period. What we need to understand is that 14 days is from the time that somebody is identified as being a carrier or have the symptoms, that it's 14 days to get through with it. So it's not when we start counting the days when the person started, we start counting the 14 days from the last person we found out. It's a rolling 14 days. And so we're wondering, I saw somebody say the other day that this was March the 75th, because they seem to be just more and more days that were in the same month, but it's not, but it's a rolling 15 days. So the way you shorten that is if you honor and respect urgently with you and your family and all of your friends, is to keep your distance, because that technically is probably the 99% of the way this is spread. And so the more we're aggressive up front and to keep that distance and keep from spreading it, then that 14 days has a chance to run. But every time there's a new case, the 14 starts over. So we really want to impress upon you and the young people and the older people and everyone, be thoughtful and courteous of your neighbors and your families and your friends. And if you want to, make a list of who you'd like to expose, because that's what you're doing if you're not paying attention to the distancing. And I don't think anybody would have a very long list. You don't want to expose anybody. And so do your part, and together we're going to win this thing. And the people that are in the trenches providing the service are doing an outstanding job. And the community is really rallying. And I'm hearing reports every day of more and more community people helping other people do things. And I'm trying to make a list. I'm not sure I'm catching them all. I know I'm not. But Corpus Christi and Nueces County have got a lot of good people in it doing a lot of good things. And we're going to come out ahead on this in the very near future. This time, Annette, are you coming? Is it, or Peter? Peter, all right.
En resumen, quiero agradecer a la Universidad Texas A&M Corpus Christi al donar 50 kits para realizar pruebas al Distrito de Salud Pública. Los kits se espera lleguen la próxima semana. Para el Domingo de Ramos es este fin de semana. El obispo Michael Mulvey de la Diócesis de Corpus Christi anunció que las misas van a continuar suspendidas hasta próximo aviso. El obispo sugiere que continúe orando, lean las escrituras y vean las misas por internet.
Okay, all right, thank you. I'm going to provide us our update on the number of COVID cases in the county of Nueces and give you some analysis on that as well. So since yesterday at 4 p.m., we have an update that is through today at 4 p.m., and that includes one additional positive case in Nueces County for a total of 41 persons that have been confirmed to have COVID-19. The headline, though, in this is that today, for the first time, we're reporting that there are 7 persons that have obtained the virus through what we call community transmission. This means that they did not get the virus from traveling somewhere where the virus is pronounced, or from somebody that is in their same household, the person-to-person contact that we have been reporting. So through through contact tracing, it is apparent now that 7 persons have obtained the virus through community spread, which means they don't know who they got it from. And that is a red flag for our community. That means that what we've been saying for several weeks needs to be adhered to even more. So that means we have to be mindful of where we're going. We need to be staying at home as much as possible. We need to be aware of our surroundings. We need to be constantly washing our hands. We need to not be touching our face. And we need to stay in place. And that's what we've been saying. And now it's even more important that we listen to that, because when you get community spread, that becomes a problem. That means that you don't know who you're getting the virus from, and it could come from anybody. And so that's an important headline for today's announcement to you, or our briefing to you. In terms of the analysis of the 41, we still have no deaths in our community, which is a good thing. We do even have some improvement in the number of persons that are either hospitalized or at home recovering. So yesterday we had 7 persons that were in the hospital recovering. Today that number is down to 3, but 2 of the 3 in the hospital are still in critical condition. And then the 38 remaining, the difference to get to the 41, those persons are home recovering today. The distribution in male and female is still pretty close to yesterday's. There's 20 male persons that have it, 21 females that have it in our community. And the age, the age distribution continues to be consistent with what it has been. The greatest number of persons are in the 40 to 49 year age bracket, followed by 60 to 69 years old. We still have that one patient that's in that 80 to 89 year category. Our test, which is an important indicator of how we addressing this virus in our community, the number of tests that we are analyzing in our labs, both the cities and counties lab as well as the private labs, is increasing. We have a total of just under 400 today. 393 cases have been analyzed in the labs. That includes information that we've received from Quest Diagnostics of about 183 tests that they performed. We're still working with other private labs to include LabCorp and some of the hospitals. We know that the mayor has issued an order that requires those testing labs to submit to our county city health lab every day the numbers that they test, and we're still working with those persons to get that information. In terms of within Nueces County, that's what I've been reporting on. 36 of those persons, 36 of the 41 are Corpus Christi residents, and then 4 persons are Port Aransas residents, and 1 person is a Robtown resident. So that's a breakdown of the demographics for today, and we'll have new updates for you tomorrow on that. A big concern for us is safety of all our employees, including the first responders. And we're happy to announce that as of right now, we have 0 or no public safety first responders in quarantine any longer. And of course, that can change at any moment. We're out there 24/7 dealing with all our constituents or all our community members. So there were 5 remaining firefighter paramedics who were in a 14-day hold period through noon today. They, back on March 19th, transported the patient who was having cardiac issues. On March 24th, some days after the 19th, it became apparent that he had symptoms for COVID, was tested, and was deemed to be positive that day. So in the abundance of caution, we placed our firefighters, those 5, into a quarantine situation, but they were released at noon today. So that means we have 0 police personnel, police officers, and 0 firefighter paramedics in quarantine. On the same line of city employees, today I extended a directive that we issued some time ago that required employees to either telecommute or work from home or be on administrative leave with pay, and that was to go through April 6th. But with the changes at the state level and then our own local level with Judge Canales' announcement, we have extended that directive so that employees should be staying home on administrative paid leave or teleworking from home now through April 30th or up to April 30th. So basically, for the whole month of April, we need our city employees that are deemed non-essential to be teleworking, telecommuting to the extent possible. And if they're not able to do that, then we'll keep them at home on paid leave to minimize the spread and the group mixing. That directive went out today, and as an example, at City Hall, where we have generally about 600 people reporting to this building, today there's a little over 100, and we're actually reviewing those numbers again, and we're going to send a few more folks home actually to telework and telecommute. So we'll have fewer than 100 people reporting to this building every day, which is a stark difference from that 600 that typically would come into the building. We one other thing, just to communicate to the public, because this is where we need people's help, or we'll have to take a Plan B action on our basketball courts. We placed up signage today, and we spoke about this yesterday. But we cannot have teams playing on the courts anymore. It needs to be pretty much one single person's doing free shooting, or a small group of a family, maybe if a mom and dad, or with a son, or the son and the dad, or a few folks in a family want to go to the courts, but we can't have group play where we don't know who we're playing with. Our infamous pickup games are no longer allowed on our city basketball courts. That includes the ones that we have here on the bay. So no team play is allowed anymore. The signage was placed up late yesterday, today. Free shooting is the only allowed thing to take place in the courts. No lights, no nighttime lighting in the courts will be available anymore. In the parks it will be. We still want our parks to be safe, but no nighttime lighting in the basketball courts. That's for a reason. We need to keep that social distancing on the courts, stay as far away as you can from the next person, and no group gathering. So we're going to try this approach. We'll give it a few more days. We're analyzing it. If it looks like we're just not getting the message out, or if people don't want to listen to it, then Plan B includes just closing down the basketball courts altogether. So this is really up to the community to know what the next step is. We're here to protect the entire community, protect you, your families, and ourselves. So we're going to go this route and hope it works, and we'll keep you updated if it doesn't. So with that, let me turn it over to Annette Rodriguez, who's going to give us an update on another drive-through testing event that'll take place tomorrow.
En resumen, las cifras más recientes es de 41 personas en el condado de Nueces que cuentan con el virus. 7 de ellas lo tuvieron a través de la comunidad. Afortunadamente no se han reportado ninguna muerte. Ayer teníamos a 7 personas hospitalizadas, hoy solo hay 3, 2 en situación crítica. El número de pruebas realizadas ha sido de 393 a nivel local. Aún esperamos el número de pruebas de otros laboratorios. También los 5 bomberos que se encontraban bajo cuarentena ya fueron dados de alta el día de hoy. La ciudad de Corpus Christi está comprometida en asegurar el bienestar de los elementos de primeros auxilios, sus familiares y la comunidad. También el día de hoy tengo un mensaje para los empleados de la ciudad. Hoy firmé la extensión de una orden que permite a los empleados trabajar en sus hogares o poder recibir otras horas de trabajo. También van a haber varios cambios en las canchas de básquetbol, van a haber varios anuncios, ya que si acude a una cancha de básquetbol va a haber esos anuncios. No está permitido jugar en equipos, solamente está permitido lanzar el balón, no habrá luz por la noche y no está permitido tener reuniones sociales en las canchas. Todas las canchas continúan abiertas, pero estas van a tener que cerrar si se continúan reportando grupos de personas en las canchas.
The Health District will be hosting another drive-through tomorrow, starting at 8 a.m., same location. The Health District continues to work on the convalescent plasma program. For those tuning in today, if you are COVID-19 positive, when you are fully recovered, you can also contribute to the cause by donating plasma to help treat COVID-19 critically ill patients. Thank you in advance. We have a very generous community. The numbers being reported on positive cases are broken down in 3 categories. The first is travel-related, 26 cases. Travel-related means, as Mr. Zanoni said, the infected person has traveled to a geographical area with high numbers of infected persons, and now they have tested positive themselves. Person to person, we have 3 cases. This is close contact. Is a community acquired, but these are between family members or roommates. A spouse tests positive for COVID-19, and then a few days later, the husband, wife, or children test positive. And then finally, and it is very important, and that I stress this, community-acquired transmission. We currently have 7 cases. This means that we are now seeing individuals in our community who are testing positive without known exposure. With community-acquired transmission, it is imperative that you stay home if at all possible and follow social distancing when out. Today, the Health District is reporting that after conducting extensive hours of contact investigations and evaluating positive cases, it has been determined that we now have the 7 cases of community-acquired COVID-19. Again, the community spread means spread of an illness for which the source of infection is unknown. After our first case, we all know that it was just a matter of time till we would see community transmission. While we do now have community transmission, it can still be controlled if we all follow the quarantine rules and stay home when ill and social distance when out in public. It is critical to practice social distancing so people do not spread the virus to other healthy individuals who could then affect others and, as the mayor stated, continue to spread the disease. Our most vulnerable populations are the elderly. The other vulnerable category in our community includes persons with diabetes, hypertension, pregnant, chronic obstructive pulmonary diseases, or other respiratory illnesses like asthma. If you fall in any of these categories, you must follow the prevention protocols even more. Stay at home and prevent exposure to people that are ill. The guidelines of prevention set out by the CD are simply baseline to make you aware of the changes you need to make in order to break the link of transmission. However, if you can go the extra step and go beyond the measures to protect yourself and others, we recommend that you do.
En resumen, el Distrito de Salud llevará a cabo otra toma de muestras el día de mañana. Continuamos trabajando en el programa Plasma de Convalescencia. Si una persona resulta positiva a la presencia del virus, una vez que se haya recuperado, podrá contribuir para ayudar a la recuperación de los pacientes que más lo necesitan. En cuanto a las cifras de personas infectadas con el virus, están catalogados en 3 categorías. El primero está relacionado con los viajes. La persona se cree viajó a un lugar con alto número de personas infectadas. El segundo es por contacto de persona a persona, o sea, adquirido normalmente por miembros de una familia o quienes viven en el mismo lugar. Y finalmente, adquirido por la comunidad. Estamos empezando a ver individuos que dan positivo sin exposición conocida a un individuo positivo, lo que es muy importante que se quede en su hogar y continúe practicando el distanciamiento social. Al día de hoy se han determinado que 6 casos del virus fueron adquiridos por la comunidad. La propagación comunitaria significa la propagación de una enfermedad para la cual se desconoce la fuente de infección. Estamos empezando a ver el efecto de las vacaciones de primavera, las personas que viajaron a un área con transmisión activa y se infectaron con el virus. Por eso es importante que las personas se queden en casa y controlen sus síntomas. Nuestra población más vulnerable son los ancianos, pero hay otra categoría que incluye a personas con diabetes, asma, hipertensión o con un sistema inmune débil. Debe de seguir los protocolos y evitar el contagio.
Okay, thank you. Okay, that concludes our press conference, daily joint city-county press conference for today. I did want to extend another thank you to United States Representative Michael Cloud from our 27th Congressional District of Texas. It's great to know we have great local leaders here with Judge Canales and Mayor McComb, but it's also rewarding and good to know that we have great representation from here that has our best interests in mind when they're in Washington, D.C. So I want to thank Representative Cloud for him taking time to come out to meet the community through this press conference and for continuing to have Corpus Christi as this focal point for him and his administration. So with that, we're ready for any questions that you all might have.
Oh, good. Don't want to touch anything. Do we have any idea of the 7 community spread cases, where they might have come in contact with the virus? Do they have anything in common with each other? I mean, is there a kind of a smoking gun out there of where it could be happening?
That's a great question, but actually the answer is no. When you do community acquired, that means you really cannot find that source of exposure, and that's where we are now. Well, we knew that would happen because once you start getting 5, 10, 20, 30 cases, there's a lot of contacts to those. And those contacts become ill again, and they spread the disease further, and so it goes so much further out that you cannot tie it back to any one source.
Are these 7 cases all Corpus Christi residents, or are they in different cities?
No, there are 7 Corpus Christi cases, yes.
Are they spread out, or are they located in specific areas of the city? Are they located in the same zip codes?
They're spread out, you know, we do look for epi-links to see if there's anything that's connected, and so what we're seeing right now is that we have transmission in all different areas of our community.
You guys are being great. Transparency is amazing. We're getting a lot of numbers, and we really appreciate it. The one numbers I'm curious about are the total number of ventilators that we have at our area hospitals and how many are currently being used. Is that something we could find out?
Yeah, we have been reporting, I reported that Tuesday to City Council. We have somewhere in the neighborhood of 90 or so. There's 2 different types of ventilators. There's the more heavy-duty ones than the ones that are used if you have mild breathing issues. But 88, so we have 88 in our reporting area. Those are available, so, yeah, here we go. Right, the mayor passed it to me. We have 88 of the ventilators, and then and then 108 of the BiPAPs. That's the lower grade breathing machine. So 88 ventilators, 108 BiPAPs. These are all available. They don't report on the numbers being used to us anyway. Doctors Regional. We have, all our hospitals are open and addressing patients. So Krista Spahn, Doctors Regional, Driscoll, yeah, Bay Area, all the hospitals are operational. The number of beds we have available, we have 52 emergency room beds, 22 negative pressure room beds, and about 20 ICU beds. That includes the regular ICU and then the neonatal. Well, actually, it's 13 PICU and 35 NICU rooms. Judge, did you want to add to that?
I did. I just wanted to issue a cautionary tale of numbers like that. You know, in lots of businesses, numbers are dynamic, but there's no greater dynamic than that in a hospital care setting. And so while you hear those numbers, just know that it's flexible and dynamic every day. You could have a terrible car accident, and that could have an impact. You could have just the daily healthcare treatment affect those numbers. So while it's always good to kind of get a general sense of maybe where you are today, it really only means something if you know it in a longer term period and you're gauging it against other dynamics. And so what I believe is that this community is prepared and we are getting more prepared. I think that's really what you want to ask and what I would want to know. And it's what I ask every day. Are we building our resources? Yes. Are we advocating for more resources? Yes. What we don't have, are we making those requests in the proper format, to the state? And are we working together so that we can share resources if we need to? And I just want you to know, I want you to worry less about the number and more about the fact that we have, in my mind, 3 strong institutions, trauma level centers that are working collaboratively. And in some cases, I have the distinction of being able to say the hospital district through the county is working with Krista Spahn every day, right? So we have a quasi-private public hospital that tends to our behavioral health needs and our indigent care. And because of that very special relationship, that private-public quasi, we have more resources than, I would say, most jurisdictions that are situated like ourselves. So you just have a very special relationship, and it's not so many, those numbers are going to change every single day. But not a bad idea if you're interested in the algorithm to look at it, but just don't look at it in one snapshot of time. That's all.
Okay.
With 4 cases now in Port Aransas, and the population, I believe, is around like 3,500, are we considering that a COVID-19 cluster?
Another good question. We haven't actually looked at it as a cluster because while we know that one was person to person, we also know that the other three were travel related. And so at this time, no, it's not considered a cluster.
Okay, do we have any other questions for today? Okay, well, that concludes our joint city-county press briefing. We'll be back again tomorrow at 5 o'clock. We'll see you then.